Hello, George Armendariz here, also known as Dr.G, joining for my podcast, Late Nights with Dr.G, where I'm going to be talking about regenerative medicine, aesthetics, cosmetics, medicine in general, as well as pain management. These are a variety of different issues that people face every day, and I think we can really get down to the meat of it and kind of understand why you need to be treated this way, why medications or natural medications work the way they do, why supplements need to be taken, why a healthier lifestyle is something that you need to focus on, and kind of really get down to the meat and potatoes aspect of why medicine is a good thing, it's not all bad, and how you can treat it so that you can be better and everyone else can be better. Hey guys, I'm Dr. George Armendariz.
So, Dr. G, can you tell me a little bit more about medicine, why you got into medicine, how long you've been into medicine, and essentially just give me your professional bio?
All right, George Armendariz, raised in West Texas, Abilene, Texas, went to medical school at the University of Texas in Houston. Originally did a internship in general surgery and was going to go move on from general surgery to plastic surgery. Chose rather to go into anesthesia and did that same place at Herman Hospital, which is part of the University of Texas system. Did my residence there in anesthesia, stayed there as a professor of anesthesia, did that for a couple of years, and then came to Arizona just for a general anesthesia job. Did that for a couple of years, moved on and focused on pain management, and continued with that for probably 5 to 7 years along with the anesthesia. And then at that point, I got kind of disenchanted with all of the pain management and the opioid issues and just with patients not wanting to truly get well. And so I kind of pivoted and went to regenerative medicine and went back and got certified in that as well as anti-aging medicine, and tried to kind of help people realize that any pain they felt or any issue they had, that they could get better. It's just that they had to put some time into it, and sometimes insurance pays for it, sometimes it doesn't. And so you have to put not only just yourself into it, but you also have to put sometimes financing into it to get yourself better, to actually get better and not put a Band-Aid on it like what happens with most pain management. Well, with regenerative medicine, there's two ways where you can get stem cells. That's going to be either your bone marrow or your fat. So I used to do bone marrow aspirations to generate stem cells, autologous stem cells, so that we could help patients with whatever pain issue they had. Well, with that, the other area is in adipose, which is fat. And so you have to learn how to do liposuction. So approximately 6 years ago, I started doing a lot more adipose-derived stem cell harvesting as well as injections. That led me to some aesthetics and cosmetics. A couple of my patients liked what I did to their flanks. They wanted to be done more. And so I said, well, why can't I do that? So I continued to do more and more of that. I've trained with several of the top plastic surgeons in the United States, as well as was accepted to the Body Contouring Academy in Paris, France. Went over there, has trained with some of the best plastic surgeons in the world, literally, just doing body contouring and liposuction. And so with that, I focus not only in the regenerative realm, where just doing regenerative medicine with both amniotic stem cells as well as autologous stem cells, but we also do a lot of aesthetics and cosmetics, and we focus on liposuction and giving those patients the contours and the shape that they want. My key to always treating these patients is that I want to help them find the body they want within the body they have.
What is your philosophy when it comes to medicine, and why regenerative? Like, I know you spoke a little bit about that.
Yeah.
Can you go in depth on your mindset behind that?
Well, medicine in general, I was drawn to it as a child, just mainly from my family doctor. And initially I wanted to go into family medicine. I came from a West Texas smaller town. It wasn't a tiny town, but it was still pretty small. And it was where there's more of a community. People know kind of everybody or most everybody. And so I felt that through family medicine was the only way that I could really help people. Unfortunately, medical school doesn't kind of teach you all this. Residency a little bit, but mainly it's when you're in the private sector and dealing with insurance companies and things of that nature. There's so much that you want to do, and doctors all around in any specialty, they want to do so much more for the patient, but unfortunately our hands are tied according to what we can do depending on the insurance that a patient may have. Some people have a really good insurance, and so we can do a lot more. Unfortunately, most people do not have as good an insurance, and so we can only do so much because paying out of pocket obviously gets very expensive with things like that. And so my philosophy going into medicine was, it's like everybody else. You want to just help as many people as you possibly can, depending on whatever specialty. Orthopedic surgeons want to fix bones, cardiac surgeons want to fix hearts. Family doctors or internal medicine doctors want to kind of fix everything, depending on if you specialize. I knew that I wanted to be in the OR after going through medicine going through medical school. And I kind of changed the philosophy of like, well, I don't know if I want to do clinic all the time. And I wanted to kind of focus in the OR because it's fast paced. Things are going on. It's a lot of procedures, obviously. And it's just wonderful being in the OR. The things that some of these surgeons can do, and even the anesthesiologists, how they can stabilize patients under serious conditions. It's pretty amazing. You see a lot of things on TV, and it's really cool, but being actually in there is what's very impressive. And so my philosophy has kind of changed from when I was a little kid, just wanting to help my fellow man, just to treat them as best I can, to now I want to treat people in a way that's actually going to, I can't say cure them, but it will give them the best opportunity to feel as best as they possibly can. Now, unfortunately, insurance doesn't always pay for that. You have to pay out of pocket, but that is something that I think is important. People have to realize that. And I think more and more people around the world, and especially in the United States, are realizing that, medicine it's a broken system right now. And if you truly want to get better, you're going to have to put some more effort into it. And I'm talking about the patient. Doctors are wonderful. They really, really are. And I know, there's a lot of good things you can say and a lot of bad things you can say. But for the most part, doctors want to help people as much as they possibly can. And I think that if we continue with this road, especially with like regenerative, that's where you can utilize tissues and different type of cellular structures that a patient already has in their system to heal themselves. Okay. I'm not a naturopath. I'm not an osteopathic doctor. These are different specialties within medicine, naturopathic medicine, osteopathic medicine. And then what an MD is allopathic medicine. And so we treat the disease. Osteopathic treats the whole person, and naturopathic treats the whole person more on a natural basis, not utilizing any type of medications and such. I think utilizing all three of those together is what really helps patients to really get better. I mean, you just can't, you have gout as an example. You can't just give them medication and go, okay, we'll just keep it there. You have to change their diet. You have to get them, doing some exercise. You have to get them hydrating themselves. There's a lot of things that they need to do. And so utilizing that as I'm getting older and as I've changed in medicine, I just found that you have to utilize a lot of different things to give the patient the best opportunity to get better.
Methodology specifically, what do you typically prescribe? What do you prescribe patients? What do you give them? And what are some of the treatments that you guys offer? What's unique to your clinic?
Now, there's a lot of doctors offering these type of things. You have the plastic surgeons or the cosmetic surgeons. They do a lot of aesthetics. Now, they don't really, other than a little medication here and there, if they're post-operative or they're about to have surgery, they don't really give that many medications. They just either do liposuction, or they give them a breast augmentation, or they do a tummy tuck or something like that. And then you have the functional medicine doctors that treat them as a whole, treating their diet, giving them something to lose weight if that's the same. GLPs are the big thing right now, which are great. I think utilizing them, in the proper sense and moderately is the best way to do that, because those type of medications, as an example, is they're mainly for morbidly obese or people with diabetes and that really have to lose some weight to stabilize their glucose levels. And so those are amazing tools to utilize. Well, some people now you have, the celebrities and people with money that they can afford these things because they are expensive, especially if you don't need them and your insurance is not going to pay for them because you don't need them. You don't have a reason why to take them, but you can pay out of pocket with them. They were taking these higher doses and they were losing a lot of weight and they look great, but the problem is there's always side effects. And one of the main side effects in those particular, for those type of medications is loose skin, which consequently helps me because they come to see me because I do skin tightening. And that kind of segues into the other thing that I do, which is cosmetic or aesthetics. And so I focus just on liposuction, body contouring. We also do skin tightening. There's various machines that we utilize for that. And then I focus along with that on the regenerative side, because on the regenerative side you can use stem cells, you can use exosomes, and those are the kind of the top two. I wouldn't say medications because they're not a medication; they're just particular tissue and cellular structures that we utilize to help the patient, whether that's for pain, whether that's for a fat transfer that you want to really maintain the results that you have, or if that's just for aesthetics to make you look younger or skin to be better or tissue to be better. And so utilizing all three of those, regenerative medicine, pain management, and then aesthetics, that's kind of what I focus on to kind of help the patient better. Now, if the patient needs a GLP, I'm kind of turned the road on that in the sense that I like to utilize those in a microdosing capacity and at a very, very much lower amounts, as well as with a proper diet, hydration, certain supplements. There's a lot of things that you can utilize and do yourself if you want to put the effort in to make a change in your body.
So can you tell me a little bit more about the stem cells specifically?
In the USA, the FDA allows for us to utilize autologous stem cells, but they also allow us to use amniotic or Wharton's jelly. These are placental stem cells. They're not embryonic, they're amniotic. And it allows us to utilize these cells, to culture them, and you can utilize them for pain management, aesthetics, pretty much anything you think that needs to be regenerated or rejuvenated, or anything that's just worn down. And so you can help those patients get better more on a natural way. Like if a person comes in, they've got knee pain, you're putting a steroid in there. Does make it feel better, but it doesn't last. And actually, in the end, it's detrimental to the tissue in there as well as the bone. Whereas regenerative medicine utilizing stem cells, they can actually repair that area. Now, it doesn't happen overnight. It doesn't happen in a month or two. It usually takes anywhere from maybe, if you're lucky, 3 months to all the way up to a year. And sometimes it doesn't even work. And that's the patients are like, well, why am I paying all this money and it doesn't even work? It's rare that it wouldn't work in some capacity, but, there's nothing's 100% in medicine. That's the difference. And also, if the patient's not healthy enough, you don't prep their body to be able to accept those stem cells to do what they need to do in repairing those areas, then obviously they're not going to work right. And so that's why, functional medicine, medicine with, natural supplements, things of that nature, just overall health is why it's very important to get these patients in a better frame of mind with that, and then just doing what they need to do so that you give these type of treatments the best capacity they can to repair whatever they're repairing. Additionally, when I talk about autologous stem cells, that's taking it from you. Now, whether that's from bone marrow or that's from fat, we can do that. There are companies here that I work with that you take a portion of their bone marrow or portion of their fat, you send it off to them. They will culture those and grow your own stem cells. And then you can utilize those stem cells for whatever you want. Your knees messed up. You want to, for your hair, your face. It doesn't really matter. You can use them for anything. And so that's the beauty behind that. Now, the FDA allows us to use those particular stem cells on first and second generation relatives. Meaning, if I have a son, he can use mine and I can use his. If my brother, my sister, my mom, my dad, you can use those cells because it is your your own DNA, your own cellular structures, that you should not have an immune response. Now, there's not 100% that you won't have an immune response, but utilizing those, I've utilized those in a lot of different patients. I've never seen one. The cool thing about stem cells is they're immunogenic, meaning they just don't stimulate an immune response. And so that's what's important here. You inject them, put them in wherever you're going to put them, and then you don't have an immune response. You have a natural response, an immune response in the sense to repair whatever you're treating. And so that's what's cool about those. And so we used to be, I would imagine, probably 5 to 7 years, the United States was dead last until the FDA allowed us, really Congress with the 21st Centuries Act, allowed us to do that, to extrapolate these stem cells, treat them, wash them, grow them, and then reuse them in patients. And so, it's crazy. We were dead last in the world. Now we're number one in dealing with therapies as well as research and such. And so it's pretty interesting because you see a lot of these other areas in Panama, Mexico, I think Germany, Spain, they do them too. They've been doing them for decades, literally. And you can go and they extrapolate cells from you, and then they grow your own cells. And then you also can use amniotic stem cells from natural births, after the baby is born. And all of those, they do work. But the thing is, the one good thing I think about the United States is that they utilize a pretty rigid system to make sure that you're getting the best cells you possibly can with no viruses, no negative things about them. So it gives you the best chance of getting the response that you're looking for, depending on what you're using those cells for. There's a lot of things that we can do that can really help patients in all aspects, whether you have pain management issues or maybe you have some there's patients being treated with stem cells that are autistic. There's patients that have had strokes, that have had closed head injuries. A lot of the football players that are retired but have had all of these issues. Those type of things, they can be treated. Now, is it a cure? Who knows? Who's to say to that? Is it going to help everyone? Probably not. But I think it's, as we learn more and more and we do more and more research, there's some cool things that this stuff does. And it's not a drug. Anything that's minimally manipulated by the FDA is considered not a drug. Now, if you manipulate it too much, then they're like, okay, that's a drug. And then it goes through, there's so much, millions of dollars and probably a decade to get a certain drug processed so we can utilize it.
Yeah. Except for COVID-19 vaccine.
Don't get me started on that. That's a whole other story right there. And so with that, you can, there's so many things you can do with it. But just unfortunately, the big pharma doesn't want us to do that because they can't make money off of this.
Right.
You can't say, oh, I'm make money off this stem cell. It doesn't work that way. We utilize those stem cells for patients, and if it can treat them and help them in whatever their condition is, then that's all for the best. And so there's a big, there's some issues there.
Do you see that being something that could red flag like the pharma, and then they'll start being worried about they're losing money because of this? Are they fighting against it right now?
It's already a thing. Just because big pharma, they're probably one of the biggest, if not the biggest, lobbying group in Congress, and so the constituents of the individual congressmen in different parts of the United States, the big pharma, lobbies that, hey, let me help you. Let me give money to this. Let me give money to that, for your particular community or whatever. And so they want certain things passed. And so if they can't control it in some way, or at least get it where the medications that they're making for their particular company, if they can't be utilized, because it's only the doctors that are going to utilize it. They're the ones we're the ones that have to write the prescription for it. And so the more natural we can be is always going to be better. It just is. It just is. Now, some medications are awesome and they help a whole lot, and you have to utilize those. But if you do the right things and you really try to change your habits, change, what you eat, what you drink, at least try to get the best. Now, sometimes, I follow a lot of guys that are physicians and biologists that do awesome things in dealing with what you should do. Don't have anything plastic, don't do this, check this, get these. those are all great, but those come from at a price, so, everything is relative. If you have the money, obviously you can do some of these things. A lot of people don't have that, but there are simple things you can do to, give you the best ability to do stuff as healthy as you possibly can. And so that's what's the important point for all of this. And I just think stem cells, and even exosomes are a cellular vesicle within stem cells that kind of tell the stem cells what to do. We have it in every cell of our body. Those are kind of newer things that are coming out. It's been around for several years, but those two particular treatments can help people in a variety of different ways.
Yeah.
And so as more and more people understand that, I think we're going to have the ability to treat more patients. Patients know that there's a cost to that, but we want to bring down that cost, so that we can offer that to them without them, taking out huge loans for that, because some people have to do that, take out large loans to get some treatments, and because insurance just won't pay for those. They see it as experimental, and so they probably not going to do it. And then that goes along with the pharma. Pharma says, we want you to take these medications, and some of those medications, don't get me wrong, are great medications, but sometimes they're not as good as they say.
More harm than good.
Yeah. I think just starting to educate yourself on natural ways to treat whatever type of cancer you may have, whether you're just starting or you're into it right now, or you're in remission, wherever you are in that process. I think looking up, we have a great thing called the internet. And so that really, it's good and bad, because sometimes it can tell you way too much. You don't know where to go. And there are some specialists, even with social media. And I wouldn't say, get your information from social media, but it allows you to find those people that at least can say, look, this is a study. You can kind of do with it what you will. And then once you read it, then you can talk with your physician who's treating you about, what do you think about this? Now, you have to take that with a grain of salt, especially with a lot of physicians, because mainly these physicians, and especially oncologists, they're used to, this is a study. Well, studies are on drugs. They're not really that much on natural ways of taking this. It's more anecdotal type of information. It's not a, they did a double-blind, randomized study, and this is what works. They do studies like that for medications because it costs a lot of money. Who funds that? Pharma funds that because they want that medication to be known as really, really good. And so nobody's funding, checking stem cells, checking these particular. There are a couple of drugs that I'm sure y'all heard about them during COVID. That people say, oh, no, you can't use those. Well, if you do your research, those drugs may be a lot better than they gave them credit for. And everybody's different, and so you gotta do what's best for you. But I think utilizing natural treatments for cancer, you can just put that in there. There's gonna be a ton of stuff that's gonna come up, and then you have to focus on your particular issue and how you think you can change that. A big thing for cancer is starvation of the cancer. How do you do that? Fasting. Fasting's a huge thing, and that's the thing. Cancers live on glucose. They have to have glucose. I don't care what cancer it is. And so if you fast, you can choke it out, essentially. Now, you will lose weight, but there are so many other supplements you can take to stabilize your weight or stabilize your muscle, let's say as an example, so that you don't feed that cancer, but you get a whole lot better, And even the medications that you would take for cancer, definitely still utilize those. I can't say, don't work, because those are known to work, but you do them along with a better diet, whole foods, fasting, good hydration, certain other medications that may help you, depending on your particular situation. So I think that everybody has to do their homework. And a lot of people don't want to do that. I understand you get freaked out and you're like, I'm just going to listen to my doctor. Unfortunately or fortunately, it depends on how you see it. This is an age now that we can study for ourselves, and you need to study. You need to find these out so that you can ask the proper questions to your doctor, so that you're getting, at least for you, the best treatment you possibly can get. On my podcast, Late Nights with Dr.G, we spoke of ideas about regenerative medicine, how we can treat ourselves with proper supplements, differences between the different types of medicine that I do, but also medicine in general, whether it's natural, osteopathic, allopathic, all the different types of treatments that you can utilize, both natural as well as medicinal, to help you get better depending on what your issue is. We're also going to be focusing on health maintenance. How can you be better? How can you make yourself healthier? And how you can treat any issue you may have naturally, utilizing some medication, but naturally through diet, exercise, and supplementation. You can find more information about this on my social media platforms at the LipoDoc as well as TrueContourMedical.com. Additionally, you can go on YouTube and find me at the LipoDoc and as well on True Contour Medical.